Oh, you know the drill. Lots of us are grabbing shovels, heading outside. Doctors warn that cold weather can be especially tough on your heart when you do those kinds of things. Today, we're joined by Dr. Kardie Tobb, Cone Health cardiologist, clinical integration officer for Cone Health Center for Health Equity. And so, all right, I did it myself this weekend, Dr. Tobb. A lot of people are going to be shoveling their driveway or doing something like that. How does cold weather impact what we do and our heart?
Anya, thanks for having me. And same here, I did it myself this weekend with my family, my husband and kids, and coming from the north. But I will tell you one thing though, the cold weather really can impact your heart during these times when you're outside plowing your snow. So what usually really happens is you're out in the cold weather, your vessels constrict, meaning like they're squeezed together, and your blood starts flowing, and we're not getting enough blood. Because what happens now when you're not getting that, the blood pressure goes up, heart rate goes up, the oxygen that really follows through the blood starts to be reduced for the heart muscles. Then that's where comes the problem, the chest pain or the shortness of breath, and that's where people start experiencing that.
I mean, we're all, I think anytime you shovel a driveway, you feel a little like out of shape, right? It does take the wind out of you a little bit because it is hard work. But at what point should we know, hey, something's wrong here? What kind of symptoms should we watch out for that we say, okay, this is too much?
So think about this. Even people that we think are healthy and not exercising can have an issue when you just wake up and start doing something rigorous. So what I would say is start slow. When you start shoveling or pushing your snow, you start to experience deep breath, shortness of breath, meaning you start breathing out of the ordinary. You want to really slow down. Definitely, if you feel any type of chest discomfort, if it's tightness, squeezing, pressure, you really want to slow yourself down. Another symptom that people don't usually talk about is that lightheadedness. You start to feel lightheaded. Give yourself a break, relax, and don't overexert yourself, because that could be slight symptoms that you're experiencing something from the heart.
Okay. All right. So heart disease, especially common in women. At what age should women make their heart health a priority?
You know, I get asked these questions all the time, and that's relevant. That's key insight for women. But what I usually say, I do key intersections in a woman's life. So I'll say when a young female start to transition from the pediatrician to their adult doctor, that is a key point. Adult from childhood, you should always be eating healthy, family traditions with things that are healthy. But that is a pivotal point in a female's life. So at that time, you start thinking about what are the tests that I can get? Is it checking my blood pressure? Is it looking at the cholesterol? What are the things? Am I diabetic if you're not type 1 diabetes? People that are overweight. So those are important times. Another time that is important again, think about, because that transition is right there for college. So when you're graduated from college around 24, 25, let that be part of your graduation gift. And if you don't get there, you can, or you didn't go to college, when you're getting to your 25th birthday, you really want to make sure you've gotten these tests done that I've said earlier: blood pressure, cholesterol, diabetes check. Are you overweight? Are you smoking? Those things are where we start talking about heart disease prevention in women.
Yeah, it is really early on for sure. And if you're over the age of 25, you definitely should be getting those kinds of tests and screenings. So let's talk about some things that are unique to women that could increase their risk for heart disease that they might need to be aware of.
There are lots of things that we have traditional risk factors. We talked about these: the high blood pressure, the diabetes, smoking, overweight, sedentary lifestyle. But there are a few key things that are important for women. It starts from the younger years or the reproductive age years. So if a woman get pregnant and have gestational hypertension, preeclampsia, they have diabetes during that time, or their babies were small for gestational rate, that is important for cardiovascular health in terms that that woman develop cardiovascular disease. Another part of this are women who have what we call polycystic ovarian syndrome. Most people will know it as PCOS. That is a cardiovascular risk marker because it causes cardiometabolic diseases, meaning that it causes truncal obesity, belly starts to expand, the hormones are mixed up, the blood sugar also goes up, causes people to have diabetes at an early age. The other thing that is not only to women, But what I want to say, the breast cancer treatment, women get breast cancer disproportionately affect women, meaning more women get breast cancer, so we don't hear about the men part. The other one, people who have rheumatoid diseases, the inflammatory diseases, markers in women enhances their heart disease risk. So even if you don't have high blood pressure, diabetes, and high cholesterol, and you have those things, you want to really be careful and you want to talk about what is your risk for developing heart disease.
Okay, and when we're talking about like the screenings that would help, someone kind of figure that out, are we talking about like the cholesterol, the blood pressure, that kind of stuff? What other things might we be talking about?
So more things we can do now, and as we expand our knowledge, we're looking at it. Because one thing I want to step back and tell people, all we're talking about, 80% of these things really can help you prevent heart disease if you do these things right. So yes, the diabetes control, the blood pressure checking, and the cholesterol and things like that. There's something called lipoprotein A. It is a genetic marker that really will tell you or tell your family members your risk for developing not only heart disease, though, stroke, as well as valvular disease. Another thing that I always say, I'm sure some people who've heard me speak will say that I say this all the time. If you're getting your colonoscopy, if you're getting your mammogram, you want to stop and think about something called coronary calcium scoring. It's a CT scan, very low dose radiation. What we do, you don't even need to get an IV line to get that test done. It's done based on risk stratification. You don't have to have chest pain or shortness of breath to do that. What's important, if that score is 0, you're really at a minimal risk or low risk. Now, if you do have calcifications, that's when you start having conversations about how do I prevent further progression? How can I get targeted for my cholesterol and looking at my high blood pressure and things like that?
Yeah, that calcium test, you need to talk to your doctor about that. Not always covered by insurance, but it sure did make me feel a whole lot better when I got that test done and realized that my score was 0. So that is definitely something to put on the table there. All right, we're going to be right back. We're taking a quick break. We've got more for you coming up.